Hello, everyone, and welcome. It's Dr. Spencer. We're going to be spending some time talking about clinical requirements. The slide deck will also be available to you as well. So, our presentation is going to cover some general information, PMH requirements, breakdown of required clinical hours, preceptors, and other important details. So, real quickly, some PMHMP requirements for clinical. Um, During your first semester, as you see in this example here, you'll be doing 250 hours, and you can break that down into 190 hours in elderly or adult population, or 60 hours in psychotherapy, or you could choose to do 60 hours in substance use disorder. Whatever that is, you would need to get at least 250 hours, as well as 250 encounters during this time in your first semester. And then in semester two, again, hours can be broken down into 125 child and adolescent hours that you're getting, or 60 in substance use disorder, 65 in an elective, um, if you say had swapped. But remember, in addition to clinical hours, students also need to get those 250 clinical encounters or patient visits each semester, with at least 500 total clinical hours and 500 total clinical encounters by the time they're done with their clinical experience. So, some more general information. All hours, again, except psychotherapy and substance use disorder, must be completed with a PMHNP psychiatrist who is a MD or DO, or a PA certified in psychiatry. Um, And so I've broken this down for you a little more. Again, remember, it's a minimum of 500 clinical hours, 500 encounters broken into semesters divided up, so 250 hours encounters each semester. So in addition to those required hours, you must document the minimum encounters of seeing 50 adult patients, those are the ages, 20 gerontology patients, those are people greater than 55. Uh, you have to have at least 50 child and adolescent visits, 20 acute crisis visits. And what is acute crisis? Well, that would be someone who follows up, say, within 2 weeks, someone who calls because they need to be seen right away, um, someone whose medication isn't working and they need it adjusted, anything like that, who may be struggling, who could be severely depressed, anxious, feeling suicidal. Then you want to have your medication management, 300 of those, 50 substance abuse patients, encounters, I'm sorry, not patients, but well, same thing, 50 encounters, and then 20 psychotherapy or counseling encounters. And these are all easily tracked in Typhon. You just need to be careful when you're documenting, and there are other videos on that, that you're giving yourself credit for those visits and that those are tabulated and counted correctly. Very important to do that. Um, and I just want to emphasize here that these hours are broken down over 2 semesters. So even if you're seeing some children in semester one, when your main focus is, say, adults, that's okay. You'll still want to count those and take credit for those. Um, Many practices see a variety of patients throughout their day. Some practices may only see geropsych, and so that would not be a problem. But you may be with a PMHMP or a psychiatrist who sees adults and children and maybe even some substance abuse or something like that. So just be mindful of that, and when you're documenting that, you keep track of that and note those encounters so you don't lose any credit for that. So again, it's a breakdown of required hours. 190 hours in adult elderly primary care setting. Must be with a PMHMP, psychiatrist, a PA who's certified to practice in psychiatry, or a clinical nurse specialist. And that can be in the inpatient or outpatient psychiatric facility, a primary care facility like a health department or an FQHC, the VA, a psychiatrist office, or even a community mental health clinic, criminal justice facilities, residential treatment centers. And with your 60 hours of psychotherapy, that must be with a master's prepared or higher degree therapist. So an MSW, LLP, limited licensed psychologist, a psychologist. Um, Certain states have different designations, but as long as they're master's prepared and provide therapy, then you can do therapy with them. If there's a question, please reach out to us and we'll help you with answering that. You can do individual or group counseling, and that can be in a psychologist's office, um, an outpatient center, inpatient center. Um, I know I did mine in a church, so wherever they're conducting those therapy sessions. And further breakdown of clinical hours, and say you did this in semester two, you do need 125 hours in child and adolescent. Now these are your hours; these aren't the encounters that we just went over. But so you need 125 hours with those minimum encounters that I showed you previously. Um, and these are the settings that you can do those in. And 60 hours of substance use disorder. Now, the thing with substance use, you can do that with an FNP, an AGNP, a PA, or a family practice MD who does substance use treatment because many places are doing that. So you could do those hours there. And then 65 hours can be an elective setting. But if you have questions, please consult with your clinical faculty or the program director, myself, to see if that would be okay. Telepsych is very common and used a lot these days. So it must include a video component. And what does that mean? That means you have to be able to see the client and see what's going on. Um, if you're, say, living in Michigan and the patient is in Illinois and your provider is in Illinois, then you also need to have an Illinois license. So you need an RN license in that state of practice. Okay. It can be used in any setting, may not exceed greater than 60% of total clinical hours. If you need to exceed that, then you can file a general petition in Typhon and submit that for us to review and look at. But telepsych is very common. Again, approved preceptors. So all preceptors need 1 year experience, um, 2 years in Washington or Oregon. PMH MP is preferred. So a psychiatrist, again, who's an MD or DO, uh, psychiatrist, not a MD or DO in anything else but psychiatry. Um, Although many psychiatrists, some of them do have dual degrees, say in neurology or something else. But again, as long as they're a psychiatrist, a psychiatric physician assistant, need to send proof of a master's degree. Clinical nurse specialist. You can use an AGNP, FNP, MD, family practice for substance use disorder only. And psychotherapy can be completed with a psychologist, not with a PMHMP, but with a licensed counselor or MSW. And again, rotations can be split between two different preceptors, but rotations less than 60 hours will not be approved. And you can't bank hours from one semester to the next. And when tracking your encounters, you can count some of those encounters as two. So let's say you're seeing an adolescent visit for medication management. Well, you get to count two of those right there as far as your encounters. Um, and say you're seeing an adult and you're doing medication management and substance use. Well, there you can count two. The hours minimum and encounters minimum must be met, even if that means you go over hours. And remember, you still have to get at least one encounter an hour. Um, and if not, you'll want to keep going to get those encounters to make sure you can meet those minimum visits and minimum encounters. And that's it. I hope this helps. Please reach out to us if you have any questions and wishing you continued success.